Welcome back. You're watching In Focus, and it's time now for our In Focus Health Update.
Well, joining us now is health reporter Linord Moudou. Hello, Linord.
Hello, Vincent.
Yeah, so you're here to tell us about some health and sanitation conditions in Uganda.
Absolutely. It's improving in Uganda. The government of Uganda has started breeding sterile tsetse flies in a move aimed at wiping out disease-causing ones. In the new technology, sterile insect technique, experts will collect about 50,000 tsetse flies in various districts. They'll have their germ cells killed before releasing them into the wilderness. Researchers say the sterile flies won't be able to fertilize female tsetses and reducing the number of flies over time. Still in Uganda, a project in Kwenjojo district is teaching residents new ways to improve methods of hygiene in and around their homes. The project, run by UNICEF, has targeted 16 model villages across the region. Communities have employed simple solutions for collecting rainwater, washing hands, and storing produce. Now, in its third year, a project to determine if water harvesting is feasible for domestic consumption is currently being tested in 150 households across 12 rural villages in Uganda. By using natural resources, communities have seen reductions in illnesses brought on by poor sanitation. Selejo Kamihanda, an elder at Kabahole village, says the program is working.
This intervention has improved our health and our living conditions. Diseases caused by poor sanitation, things like worms, have reduced drastically. So now we have peace and we're able to do our domestic work.
This intervention has made the community know that they can use their own initiatives, local materials, and improve their hygiene and sanitation.
Now, here in the United States, a new study may help end the debate over how best to slim down to or maintain a healthful weight. Researchers find that while there are many elements to a good diet, while carefully limiting calorie intake is the most important part of controlling one's weight. 60% of U.S. adults are overweight and more than 30% are obese. But Americans aren't the only ones struggling with their waistlines. The World Health Organization reports that obesity has reached epidemic proportions globally, with more than 1 billion adults overweight. Dr. Darius Mozaffarian studies the relationship between diet and chronic diseases at the Harvard School of Public Health.
We need sort of a shift, a paradigm shift in our focus and attention to diet.
But people trying to change their eating habits and reduce their weight must sort through a bewildering variety of diets. Some recommend cutting out carbohydrates. Others say cut out the fat, eat more protein, eat less protein. The messages can be confusing. Dr. George Bray at the Pennington Biomedical Research Center in Louisiana wanted to find out if protein affects weight gain.
This study was designed to examine the effects of differing levels of protein on total calorie intake.
25 healthy adults participated in the study. Daniel Cohn was one of them. He and the others were overfed by almost 1,000 calories a day.
I was eating a lot of real butter, for instance, real whipped cream and things of that nature that I don't normally indulge in.
All of the participants followed low, normal, or high protein diets. The result, all of them gained weight.
Fat storage was exactly the same with all three levels of protein. It was the calories that they ate that affected the body fat that they stored.
But those who ate a higher percentage of protein gained more lean body mass, while those on a low-protein diet experienced just the opposite.
If your protein intake's low, you'll actually lose body mass, even though you're eating an excess amount of calories.
Dr. Bray tells his patients to get on the scale regularly so they can catch added weight early. Dr. Mozaffarian says keeping weight in check is not just about eating less.
We don't need to go down a list of avoid this, avoid that, become food police. It's really actually mostly foods that should be increased. It's fruits, vegetables, whole grains, fish, vegetable oils, and nuts.
Dr. Mozaffarian says increasing these 6 foods by about a serving a day would reduce obesity and help slow the epidemic of chronic diseases associated with it. Dr. Bray's study on protein, calories, and weight gain was published in the Journal of the American Medical Association.